Hello, friends. A new case today. Let us see. A young man presents with severe vomiting and nausea which started an hour ago. He recalls having a fried rice dish at a local Chinese restaurant 4 hours ago. So, what could be the possible diagnosis? What is the likely causative agent? What is the pathogenesis? What are the investigations? What is the treatment and prevention strategies? Let us dive into it. So, this is a classical case of food poisoning with vomiting, that is emetic syndrome, and the likely causative agent is Bacillus cereus. The clue here is a very short incubation period of 4 hours, and the rice dish, which is a very common contaminating food in case of Bacillus cereus, and only vomiting is present, so emetic syndrome. So these three, they highly suggestive of Bacillus cereus food poisoning, emetic syndrome. Now, what is the pathogenesis? So, Bacillus cereus, they are gram-positive rods with non-bulging spores. The source is soil, and this bacteria they contaminate the uncooked food. And during high temperature cooking, they develop protective spores. But later, when the food is rewarmed, the spores germinate into vegetative bacteria and secretes one of the two major toxins in the food, either emetic toxin or diarrheogenic toxin. And if you ingest this food or preformed toxin, you may end up in food poisoning. So let us see what is the toxins and what are their mechanism of action and what is their manifestation. So this Bacillus cereus, it has various serotype, but serotype 1, 3, and 5, they usually contaminate the food item that is rice. And in some cases, which is the classical presentation, is the Chinese fried rice, which is usually rewarmed. And this Bacillus cereus 1, 2, 3, 5, they contaminate it and they multiply in this food item and produce heat stable toxin, enterotoxin. And this heat stable enterotoxin has a mechanism of action which is very similar to staphylococcal enterotoxin. And whenever you ingest this food with this preformed toxin in the food, the exact mechanism is unknown, but somehow it causes vomiting, nausea, and abdominal cramp. And that is known as emetic syndrome. And the beauty of it is that it has very short incubation period, which is very diagnostic of this condition of 1 to 5 hours. And because toxin is heat stable, if you rewarm or even fry the food before serving it, it may not destroy the toxin. And Bacillus cereus serotypes 2, 6, 8, 9, 10, and 12, that means apart from 1, 3, and 5, uh, they usually contaminate meat, beans, cereals, and vegetables. And if you ingest this food, the toxin will be produced inside the body, in the intestine. But this is Heat-labile toxin, and it has a composition very similar to E. coli labile toxin. That is one active unit which is surrounded by five binding subunits. So AB5 toxin morphology is there, and it increases the cyclic AMP level just like labile toxin, which decrease the reabsorption of NaCl from intestinal lumen, which end up having watery diarrhea, fever, and abdominal cramps, which is known as diarrheal syndrome or diarrheogenic food poison. And incubation period here is longer because the toxin has to be formed inside the body. So it is usually 15 to 20 hours after the ingestion of contaminated food. So apart from this food poisoning, Bacillus cereus is also involved in other infections. For example, traumatic eye infection after trauma, keratitis, or panophthalmitis are usually seen with Bacillus cereus. Medical devices and intravenous catheter related infections, which are usually systemic in nature, like endocarditis, meningitis, osteomyelitis, and pneumonia, are also seen with Bacillus cereus. So, if it is a food poisoning, investigations are usually not performed. But if you want to perform it, you can detect this toxin in either food, vomit, or feces. Some people can go for feces culture, and if you are doing feces culture, you require a selective medium that and which has to be enriched also. So MYPA medium, that is mannitol, egg yolk, polymyxin, biphenol, red agar, in which you will see this gram-positive spore-bearing rod to be grown. So what is the treatment for food poisoning? Because it is a self-limited condition, it will resolve on its own. So you require just fluid support to prevent dehydration. So rehydration or fluid replacement is best for food poisoning. But if it is eye infection or systemic infection or blood infection, then you require antibiotic. And because it is multi-drug resistance, sometimes seen, so vancomycin is the preferred drug of choice. So penicillin and trimethoprim are usually resistant. Penicillin resistant by beta-lactamase is produced by this bacteria, and this is susceptible to vancomycin, clindamycin, erythromycin, and tetracycline. But vancomycin is the choice if it is systemic infection. Prevention, how we can prevent this condition? Good food handling and storage practices, and we should not avoid rewarmed or reheated foods, especially rice. So this is all about Bacillus cereus food poisoning. I hope you like this video, share it with your friends and colleagues, and do subscribe to the channel for regular updates and notification regarding video uploads. Also check out the book, which is available at the Amazon and Flipkart, Case-Based Medical Microbiology, unveiling case by case. So thank you very much. Happy learning.